Hello, I'm Dr. Jonathan Amspacher, and I wanted to take a few minutes to talk to you today about taking care of your hand after carpal tunnel surgery. Carpal tunnel is a very common surgery that we do for a lot of patients to relieve hand pain, and usually at this point you've already had your workup and your evaluation, and so I wanted to talk to you after surgery how to take care of your hand. There's a couple of key points that I always tell folks, and I say there's 3 words that you have to remember if you want to have the minimal amount of discomfort after your surgery, and that's elevation, elevation, and elevation. The more that you keep your hand propped up above the level of your heart, the less pain and swelling you're going to have, because when you have your hand laying below the level of your heart, then it swells and it brings more inflammatory chemicals that cause pain in your hand. And so whenever you're sleeping, I recommend that you rest it on your chest or prop it up above the level of your heart with several pillows when you walk around, and then I like to tell you that you maintain one of 2 poses. Either I swear to tell the truth or cross my heart, because keeping your hand up at that level will decrease the amount of pain and discomfort that you have. Generally, we'll wrap you in a padded wrap that has some fluffy gauze along with an ACE wrap on it. And I tell folks you can adjust the ACE wrap for comfort. If it's too tight, feel free to loosen it up. If it's too loose, you can tighten it up a little bit. You always want to make sure that you're having good blood flow to the fingers and that you feel like you're nice and warm and that your hand feels comfortable. Other things to watch out for: very rarely you would want to watch for any signs of excessive redness. You may have a little redness right next to the incision or right next to the sutures, and that'd be normal. But if it expands out to the area the size of a quarter or a $50, then that's something you want to give our office a call about and let us know that there's something going on, or if you have drainage from it that's unusual or irregular. Other things to watch out for is any excessive swelling. You'll have a mild amount of swelling and bruising, and that can look like a little bit of edema to the area. But if you have something that swells up the size of a golf ball, then that's something we need to know about. We'd want you to give our office a call and say, hey, I'm having a lot of swelling or a lot of changes in my symptoms after surgery. You know, we expect you to get better and better for the first 3 to 5 days, but if things start getting worse after 3 to 5 days, that's something else we'd want to know about and take a look at you for. If you have any questions, please feel free to call our office at any time. Thank you.